upon the patient and the case that we are going to operate. He happens to have a positive family history of hair loss, which is a typical male pattern baldness. He's been experiencing hair fall since around 3 years, so as to say. He came to us for a consultation regarding hair loss. After evaluation of his genetic history, health, any recent change of place, diet habits, the scanty hair loss that you see here in the occipital area, even the V's, the two V's that you see is called as temporal recession. You see on either side, there's a temporal recession. His hairline has receded, something which should start around 2 to 3 millimeters ahead has gone back. There's hair loss even at this region, which is the crown area. So such a patient generally falls in a classification of say between grade 3 to grade 4A. We have planned for a hair transplantation. The markings have all been done. This happens to be the posterior area, also called the occipital area, as you can see. This tracing happens to be his natural donor area. So follicles will be extracted using FUE technique from this donor area using punches. The same follicles are preserved and harvested in the frontal and the crown area for him. He will require a good amount of work considering his hair loss both in frontal and occipital. addressed it beautifully in the frontal, filled all the temporal recession. You can look down, you can show the camera. Yes. So the frontal, the hairline has been restored, both the temporal triangles have been restored, and the crown area also. The white dots that you see is the dermis layer of the hair follicle. This needs constant irrigation every gap of every hour or every 45 minutes. The dressing that we have given tends to become quite tight. This is to prevent any kind of swelling coming down onto the eyes or the face. This is removed generally on day 3. Post this, there will be a shedding phase. The waiting period will be around 2.5 to 3 months. 3 months, why? Because this is a normal phase of a hair follicle to grow. So there will be a shedding phase followed by the growth. The bulb of the hair will be intact, it will be within your scalp. The shaft of the hair, the black portion that we see, that will start showing up, say around 2.5, 3 months or beginning of your 4th month. The instructions post-operative care, it's very simple, but it has to be in a scheduled manner. Hair wash has to be avoided, probably till the 10th day. And there's a schedule which we give it to the patients. It's very simple to follow. The procedure is done under local anesthesia. Are you having any kind of pain, sir?
No.
During the procedure, it did take a bit of time, but we took breaks in between. Are you comfortable during the process?
Yeah, completely comfortable.
Okay. So yes, the only disadvantage remains it's a little lengthy procedure, but we do take breaks, and discomfort is minimal because of the anesthesia.